Thank you very much indeed for this honor. I will be presenting on retinal AI/ML model for risk prediction in systemic diseases, which we developed over the last few years. So as we know, eye care is primed for machine learning. Eye is completely transparent. We are familiar with telemedicine. It uses all levels of healthcare systems and existing care gives are there. So the first AI work was in 2011 to 16. Basically, we looked at identifying exudate contours using hidden McLeod random field and classification. And so we had segmented out each of these, optic disc and hard exudates and microaneurysms and hemorrhage and fovea, etc. And we found out that our methodology had an F score, which was very high at that point of time. This is the automatic segmentation of microaneurysms. You could quantify the microaneurysm, you could count, you could look at leaking versus non-leaking. This is a quantification of hard exudates. And we can actually quantifically, mathematically represent them for all follow-ups and stuff like that. So this was the initial work which was done in 2016. And then by that time, there was a huge race to match expert performance with AI in a lot of diseases, including diabetic retinopathy, glaucoma, AMD, and the rest of it. And then came Google AI, which was really super accurate in the lab, but real life was completely different because different cameras posed different problems and the machine could not identify. A lot of problems came in. And at that point of time, I was also a little busy into the basic biology work, predicting diseases, non-response to treatment using cytokines. There's a newer molecular target for treating diabetic retinopathy orally, which we found out, which also works through the gut-eye axis. There's a topical anti-VEGF and steroid combination which can be used inside the eye, and also developed the Indian Clinical Ophthalmology Clinical Trial Network with over 20,000 patients, each patient having 800 data points. So to start with, we started with coronary artery disease. There was a lot of similarities in the coronaries as well as the retinal vessels, and we looked at it, and the objective was automated detection of coronary artery disease patients and patients at risk, and to identify early signs of CAD based on retinal imaging, segmentation, feature extraction, and classification algorithms. So these are the publicly available data sets at the beginning of our study, basically by about 2021, and these were the segmentations that we did. And we used a modified ResNet, which is developed, and we modified it to modified ResNet. And we did feature extractions from hard exudates, soft exudates, hemorrhages, optic disc, and quantified them with the possibility of coronary artery disease and stroke from these patients. So these are some of the feature extractions that we did. And the vascular extractions, and you should understand that we made about 27 quantific indices from the vasculature, and these were some of them. And we looked at coronary artery disease, stroke versus normal. We found out whether they are different. And the current status of the CAD stroke kidney AI models is that we have 50,000 images of CAD stroke patients, 20,000 images with CKD, world's largest data set of COD and stroke retinal images. Dataset is published in India, positive review from the Nature journal, waiting for publication in Nature, which is the best journal, and second largest dataset of annotated retinal images after the UK Biobank. 4 patents and 85% sensitivity and specificity. Already a US company has taken it for marketing it in the US for predicting coronary artery disease risk and stroke. So we are moving further into genomics, proteomics, and integrating that with the imaging biomarkers. So this is fusion of multiomics and imagery which we are looking at with 4 different techniques. And once we have this, we have the morphological morphological variants which would come through imaging biomarkers, and the biological variant which would come through proteomics and genomics. And so currently our ophthalmological research, we have 4 grants from ICMR, we have 3 from DBT, DST1, Industry 4, Patents 4, and totally more than 20 core grant, 20 clinical trials, and developed 35-member ophthalmology research team.